So, for my master thesis in 2013, I looked at the differences in health parameters in rural India. I visited India during the autumn semester and stayed there and visited 4 different states in India, Madhya Pradesh, Rajasthan, Orissa, and Bihar. The choice fell on these states because the program was implemented in these states because of there being rural areas. They're poor. They have an uneven sex ratio, which is known, so they wanted to try the intervention on these states. And yeah, so that was basically just what I said. And even though the sex ratio has improved since 1990, there are still fewer girls that live till the age of 1 and 5 in India in total, and especially though in the rural areas. And this was a collaboration between NIPI, a Norwegian-Indian Partnership Initiative, controlled by the Norwegian Embassy in India, and National Rural Health Mission in India, which is an organization there. NIPI mainly provided with financial support and technical guidance, while as NRHM were the ones implementing the intervention in each state. In India, in general, the sex ratio is pretty much the same as the natural expected birth ratio, no sex ratio. But if you look at different states, there are some states where there are as few as 860 girls per 100 boys each year. And this indicates that there is something that someone either aborts female kids, or that there's something else that isn't happening naturally, or isn't the way it's naturally supposed to be. It's more common to see a sex-selective abortion happen in families that only have girls from before, and less so in families that have boys. So it's speculated that the wish to have a boy is stronger than the wish to not have a girl. So if you have a boy from before, you don't take a sex-selective abortion that often, but if you only have girls from before, it's more common. Okay, and then over to what I actually did. So the selection was based on 2 interventions. The first one was the home-based postnatal care, which happened in 3 of the states, and that was home visits by ASHA before and after birth. As Yashoda was just telling us about, the ASHA is accredited social health work activist, which is basically a woman in the rural area, in the local area, basically in the village, who is trained by health professionals, and then she visits families that are expecting, and she visits them both before birth and after birth. She tries to motivate them to give birth at a hospital, and then after birth she tries to just check up on the baby at several points, and then refer them to hospital if that's needed. To check up on both, mainly the kid. And the other one was sick newborn care units, which were started off as newborn care intensive units in all the different hospitals. So there were basically 2 or more in each of the 3 states. And they were a part of the hospital in that area, and children were admitted free of cost, and the treatment was also free of cost. So they try to keep the barrier pretty low to be admitted and for the hospital or that apartment to actually work. They wanted most people to use that. And you could either be referred from the hospital itself by either, if you're born there, you could directly move to that unit, or you could come from the village itself, like you could visit if your kid was sick. And the first thing we looked at was where the kid is born, if the kid is born at home or at the hospital or at some health facility. And we saw that more boys are born in hospitals, but when we looked at each of the states, this was only true for Rajasthan. And there have been some articles saying that sex-selective abortions have become more common in Rajasthan or other rural areas where they weren't that common before. But since this is not a topic which is talked about a lot in India, or you don't talk about it openly, so the data or all the numbers we have from that are based on a lot of speculation and are really difficult to analyze because there's so much uncertainty connected to all of them. And the place of birth or how many are born in a hospital doesn't say anything about the treatment after birth, which is much easier to examine or to check for and analyze than sex-selective abortion. And as a clinical nutritionist, the most important thing for me, or the one thing that I used the most time on in my master thesis and when I was out there, was the timing of the breastfeeding. We split it up in 3 parts. Either you started within an hour after birth, within 1 day, or you waited more than 24 hours to breastfeed your baby. And we actually found out that more girls are breastfed early, like within an hour of birth, than boys. And this could be, at first it looks very appealing and very good that more girls are actually breastfed early. But we tried to look at the reasons for it, and one of the reasons could be that when the hospitals and health workers, a part of this intervention, are trained, they're told about the uneven sex ratio and the uneven treatment. So they focus more on the female child, and as a consequence of that, more girls are, more mothers that have girls are focused on, and then they're more regularly followed up and told to start early, and they're more focused on than those with boys. The other thing is that there's a lot of rituals and traditions connected to the birth of a child in India. And a lot of these rituals and traditions lead to a delay in when you start to breastfeed, because either the aunt of the baby has to see the baby before, or you have to give that or that to the baby at first, something sweet. So there's a lot of rituals around that. And some families might follow these rituals more, feel that these rituals are more important for a baby boy than a baby girl, which leads to a baby girl being fed earlier, which is surely a positive thing, but the ideal thing would be that there's no difference depending on the sex of the baby. And next thing actually covers that as well, that more boys are referred from outside the hospital, also from the village, than girls. And there's no reason for more boys to be referred from outside the hospital based on the illness, because both boys and girls get sick, and there shouldn't be a difference in the amount of babies for each sex that are brought into the hospital. But there's been a lot of articles and a lot of research that shows that sick girls are often not taken to the hospital, even though they're quite sick. And it's easier to take a baby boy than a girl. And the girls are often taken when they're really sick or after another treatment at home or by someone in the local area hasn't worked. And as a reason of that, more girls die at the hospital. In this paper as well, we saw that there was a significant amount more girls that died at the hospital compared to the boys, which is explained by the exact same reason that sick girls are brought to the hospital much later than baby boys, and they therefore have a bigger risk of complications. So the most common causes of death are prematurity, low birth weight, or just like things that might seem very common and very much treatable, but by the time they reach the hospital, they're quite sick and they have a lot of complications, which leads to a higher risk of death. And I think that was it. You didn't even have to put up another card. Okay, thank you.